So just a few housekeeping rules. You will be able, as participants, to intervene in the discussions. We will start with the presentation, and then we will have a first round of questions and comments. You will be able to chat during the presentations if you have any questions, if you have any comments. There should also be a couple of documents for downloading. We have uploaded a couple of documents for downloading if you're interested to see the presentations afterwards, and the report of the UN Special Rapporteur on the right to housing for persons with disabilities. So, I'm Director of Mental Health Europe, which is the European-wide umbrella organization in the field of mental health. We work on mental health promotion, prevention of mental ill health, and the rights of persons living with psychosocial disabilities or severe mental ill health. And why are we interested in this topic of housing? Well, I would say, first of all, housing has an impact on the mental health of everyone. It can be for better, for worse, in a positive or a negative way. The factors that influence mental health. Sorry, we're really rushing through the first slides now because we were running a little bit late, so I will just say in a very few words what we will do today at this webinar. I already introduced a little bit the organization, but why housing? So the factors that can influence your mental health in relation to housing, it's much more than just having a roof over your head. It's about the standard of living. It's about whether the housing you have is suitable for you, for your family. It's about whether it's safe for you, where it's located, whether you were free to choose your housing or not, and whether it's affordable or not, and much more. But also, and that's the topic of today, housing is a human right for all. And still we know that people with psychosocial disabilities face many barriers to housing. And available options are often not human rights compliant. People with severe mental ill health are affected by homelessness, including rooflessness, and very many persons with severe mental ill health still face institutionalization and involuntary placements. So it's also difficult still for many people to freely choose the area where they live because there's a lot of stigma and sometimes fear among neighbors, and many other reasons that that create barriers for people with psychosocial disabilities to access the right to housing. But if we want to ensure inclusion, and if we want to be successful in moving from the outdated model of mental health, from institutionalization to community-based services, then we need to look into these issues, including the right to housing. And we will discuss that today with a couple of really interesting speakers. And our first one is Mrs. Leilani Farha, who is the UN Special Rapporteur on the right to adequate housing. She will make a keynote speech for us. She's a Special Rapporteur since 2014, based in Canada, so good morning. I think it's still early on your side. And Mrs. Farha, you're also the Executive Director of the NGO Canada Without Poverty, a lawyer by training who has been working worldwide on the right to adequate housing for the most marginalized groups. So I will now pass the floor to you, and thank you so much for joining us today.
Oh, there we go. Unmuted. There we go. Well, good afternoon, good morning. I don't know where people are participating from, so just general warm greetings. I'm very excited about this panel and this webinar. I will say, for the organizers, I have never been on a webinar that didn't have technical difficulties. So your experience seems to be just par for the course. And I'm going to apologize at the outset. Something has come up at my end and I have to leave a few minutes early, and I apologize. I will have to leave about 15 minutes early. and it was just unexpected, and I have to deal with Geneva time, so I have to do something before they close. In any event, as was said, I'm the Special Rapporteur on the right to adequate housing. I've been in the position appointed by the UN Human Rights Council since 2014. And I just wanted to comment on the report that I wrote and sort of where it came from. Why did I devote a report to housing and persons with disabilities? And I have to be honest to say that it really came from my personal experiences. It was not dictated to me to do such a report. I wasn't even, in fact, lobbied by disability rights groups to do this report or by housing groups. But I have long worked on issues of housing and homelessness in particular. I know that in pretty much every country, there is disproportionate representation of persons with psychosocial disabilities in the homeless population. And I have seen firsthand as rapporteur the lived experiences of persons with disabilities and the way that interacts and manifests with respect to housing. And I have been so moved, and I have a feeling of I don't know what the word is, but a kind of desperation, a feeling that I had to say something and write something. And at the same time, I feel within the bubble and small world of international human rights law, we can make really, and are making really positive developments and strides to protect the rights of persons with disabilities in the area of housing. And so I thought, well, this would make for a good report. I think the report, I mean, you can all read it when you have a chance. I admit that the report, to my mind, is maybe a little bit legalistic. And so what I'm going to try to do in just a few minutes is bring it to some life for you. Some of the things I'll say have already just been said, but they always bear repeating, and certainly you might like to hear of my own insights. So I thought what I would do is just explain a little bit about the actual lived experiences of persons with disabilities, in particular those with psychosocial disabilities and suffering mental illness, and how that manifests in my experience in the realm of housing. And then I thought I might just touch on you know, what does international law say about all of this? Where are we, or where aren't we? And then I'll end with a kind of broad, maybe it's a recommendation, or maybe it's just a sort of broad conclusion. It really is my experience that persons with disabilities suffer some of the most egregious violations of the right to housing. Obviously, forced institutionalization is a direct attack on the right to housing. It's an attack on the right to autonomy, to liberty, to human dignity, and yet it remains a practice that is relied upon throughout the world. We do not have a world that has completely deinstitutionalized by any stretch of the imagination. We know that the conditions in institutions are deplorable. I have visited one or two in my country missions. There can be cruel and inhuman treatment. Obviously, I have not been exposed to that treatment directly, of course, because when I visit, that gets cleaned up. But we know that that happens, and that there is physical, sexual abuse, violence. Sometimes, you know, there's no access even to proper basic services, sanitation facilities. Outside of institutions, I don't find the circumstances to be much better. When I go to informal settlements, for example, what I find is that people with disabilities, and particularly those with psychosocial disabilities, are cordoned off, often living like at the back of a home. Children, I've seen so many times children with psychosocial disability of some sort, or developmental disability, you know, in a room with a television on, left completely isolated. I've heard of, you know, stigmatizing abuse, shunning, ostracization, if that's a word, neighbors being, disquieted or feeling discomfort, or a kind of ignoring of those with psychosocial disabilities, a kind of we don't see it, we don't talk about it, that kind of thing. In sort of more developed areas, I have heard that people with psychosocial disabilities are often treated as unworthy tenants because of abnormal behavior or antisocial behavior. People with intellectual disabilities are often assumed to be unable to take care of the premises that they're living in, and are often prevented from signing rental agreements saying that they lack legal capacity. As I said, of course, people with psychosocial disabilities and mental ill health are disproportionately represented in the homeless populations and are really not likely to access supports necessary to transition into permanent housing. And I think Samara might be talking about that after I finish speaking. And so, one of the things that happens with all of this is that there ends up being a dependence on caregivers or family members, and then that creates a cycle. So the person can't live outside of their family home because there's nowhere for them to live, or they will be institutionalized. So they remain in the home, and then they are subject to stigmatization, discrimination, etc. So those are pretty bleak circumstances. I'm sure I have not done justice, in fact, to the bleakness and the assault on human dignity, the lack of choice. If you think about how we as able-bodied, those of us who are able-bodied, how we take so many choices for granted. And then my experience working with persons with disabilities is, no choice can be taken for granted, and choice is so severely limited. And that, of course, goes to the heart of being a human being and human dignity. What I try to do in my report with the law, with international human rights law, is to try to start creating more of an interaction between the Convention on the Rights of Persons with Disabilities and the Covenant on Economic, Social, and Cultural Rights as a way of responding to these realities. Because I think we need both bodies of law to move forward and to really address the issues that are being experienced by persons with disabilities in the area of housing. What I've tried to do, and I hope successfully and I hope clearly in the report, is to show that the right to adequate housing of persons with disabilities can be in dialogue with the jurisprudence and commentary, its own jurisprudence and commentary, and through the Covenant on Economic, Social, and Cultural Rights, and the framework that is emerging and has developed out of the CRPD. So, if you look at the right to adequate housing, it's enshrined in Article 11 of the International Covenant on Economic, Social, and Cultural Rights, and it has been understood to encompass obviously much more than physical shelter. It's recognized as the right to live in security, peace, and dignity. It is fundamentally connected to rights to life, to non-discrimination, and the freedom to choose where to live, as well as other rights like freedom of expression and association, and to participate in public decision-making. It includes issues like, in order for housing to be adequate, it has to include security of tenure, the availability of services, obviously hugely important for persons with disabilities, materials, facilities, and infrastructure. Housing should be affordable, it should be habitable, it should be accessible, and it should be in an appropriate location and culturally adequate. And of course, all of those components of the right to housing have special meaning for persons with disabilities and give rise to particular obligations on the part of states. And in my report, I'm not going to go through it, but if you reference paragraphs 50 through to 58, I go through all of those elements of the right to adequate housing and give examples of the way in which they are pertinent to persons with disabilities. I'm just going to see if I can pull out a sort of straightforward one. So availability of services, for example. Obviously, the availability of services is essential to independent living and agency over where and how to live in the community. Access to water and sanitation is a priority issue, obviously, for everyone, including for persons with disabilities. States must ensure that persons with disabilities have access to a diverse range of services linked to living autonomously. As articulated in Article 19 of the CRPD. So you see, I'm trying to merge the two. So that would include in-home, residential, and community support services. So that's just one example of the way in which we kind of need to take the elements of adequate housing as defined under the Covenant on Economic, Social, and Cultural Rights, and if you infuse those elements with an understanding of what they would mean for persons, for example, with psychosocial disabilities or other disabilities. So while we need to do that using the right to adequate housing, I think we also have to incorporate the transformative understanding of the human rights of persons with disabilities that has emerged from the CRPD. I call it the disability human rights paradigm. And in my opinion, it gives a new meaning to the concepts of interdependence and indivisibility of rights, in particular in relation to the right to live in dignity in a home within a community. And one of the central features of it, which has also already been mentioned, is that it sheds a sort of charitable or medical model or approach to disability. And it recognizes instead that discrimination, inequality, and disadvantage are socially constructed responses to diversity and difference. The disability rights paradigm offers a human rights-based alternative where it places persons with disabilities at the center of their own lives and as subjects of rights, as rights holders. So it shifts the way we look at persons with disabilities. They're no longer just if they're lucky, the beneficiaries of services and charitable supports, but rather they are rights holders with entitlements. It is quite a shift. It recognizes that discrimination often takes the form of programs and policies designed to meet the needs of dominant groups while ignoring the needs of persons with disabilities. And the disability human rights paradigm obviously affirms that dignity, autonomy, independence, and participation rely on not only freedom from institutionalization and state control, but also positive measures on the part of governments to support the right to live in community as one chooses. So it's not enough for governments to just say, oh, okay, we'll deinstitutionalize. That's kind of a negative rights framework where they stop their activities that infringe on rights. But we're saying governments need to do more. They have to create the conditions in communities to allow for independent living and autonomous living. And this is so very relevant, obviously, for persons with psychosocial disabilities and mental illness. So just to be very clear, the convention itself on the rights of persons with disabilities does enshrine the right to adequate housing, and it does so in my articulation in two ways, sort of very directly. It includes in Article 28, I think it is. It is Article 28, the right to an adequate standard of living, including housing. And that mirrors the way it's referenced in the Article 11 of the Covenant on Economic, Social, and Cultural Rights, and a whole host of other treaties, although it doesn't only use a discrimination framework, so it actually affirms the right itself. So it doesn't say just that persons with disabilities should be free from discrimination with respect to housing. It says that they actually have the right to housing itself, and we can talk about whether that distinction is necessary or not. One of the things I have found is that where governments and private market providers of housing and social housing providers understand. They don't always do it, but they understand that a person with a physical disability may need certain kinds of accommodations, physical accommodations within a home, like a ramp or, you know, grip bars in bathrooms and wider doorways and that sort of thing to allow for wheelchair or walker access. I have found that there is far less understanding of the actual physical things that might be required to make independent living possible for a person with a psychosocial disability. For example, you know, soundproofing rooms. I've heard that, you know, as a common thing that would be helpful. And you know, if I bring that up with state providers of housing or other providers of housing, it's sort of like, what? Where is this coming from? In any event, that was just a sort of side note of something I have noticed. The CRPD also, of course, enshrines the right to live independently and be included in community, and that's in Article 19, and is obviously crucial to the right to housing for persons with disabilities, because it explicitly enshrines the holistic approach to rights that are necessary for their realization. Obviously, the right to housing will never be realized for persons with disabilities without accessible communities that foster inclusion and participation of persons with disabilities. And this, again, goes to that idea of states needing to take positive steps to make it possible for states, and by states, sorry, I should say, I also mean local government. International human rights law applies to all levels of government, and it's often local government that's going to be dealing with these issues. But there have to be positive measures taken so that support services are in place, for example, alongside housing. So I want to be short because I know we're pressed for time. I just want to say one of the things that is, of course, really central to a human rights-based approach to ensuring adequate housing for persons with disabilities of all kinds is access to effective remedies for violations, mechanisms. You know, you need access to justice and claiming mechanisms in order for rights to be realized and for rights not to be illusory. And that is one area that I found as a gaping hole, shall we say, in the legal landscape or legal architecture landscape for persons with disabilities. When I went to review case law from around the world and international jurisprudence, etc., I found really scant court cases, tribunal cases, etc. So when I say access to justice, it doesn't have to only be courts, although it could be courts, it could be tribunals, administrative bodies, etc., but somewhere where you could go to claim that your right to adequate housing was being denied. And it seems to me that there are, given the lack of jurisprudence, it suggests at least a lack of accessibility of existing mechanisms, and it suggests perhaps a lack of mechanisms. I found one case out of the United States. Now, I would be happy if I'm wrong and that my research wasn't as thorough as it could have been, so please someone tell me. But I found one case out of the US. Let me see, it's called Olmstead, and in that case, the court recognized that states have an obligation pursuant to the American Disabilities Act, so that's what was an issue here, that that states have to take reasonable measures to ensure that persons with psychosocial disabilities are able to live outside institutions in the least restrictive environment, with access to services, and if there was a wait list for services, that wait list had to move at a reasonable pace. So maybe not the most progressive decision, but certainly a decision that's and that's out of the U.S. Supreme Court. Certainly a decision that's positive, but as I said, there are really scant cases that seem to support the right to housing for persons with disabilities and psychosocial disabilities in particular. And lastly, I'll just say, you know, in terms of recommendations, my report gives actually a huge number of recommendations, more than most of my reports do. But the one that I think is probably most important is, in my mind, is that this shift that states have to make. I mean, I think that there has to be a different perspective taken with respect to persons with disabilities and how states interact with their human rights. I think we need to move squarely beyond just simply non-discrimination and a step back, don't do any harm kind of approach, to a much more proactive, put in place what's necessary, recognize need and answer that need. And I'm hoping that's a nice segue to Samara's comments. So I'll end there, and happy and looking forward to take questions and for our discussion.
Thank you so much, Leilani. That was really very informative and a very good start for our webinar discussions, I think. There were already a couple of questions coming in, so I thought we should maybe have a first round of questions before passing the floor to our second speaker. So one question comes from Croatia, from Ivana in Croatia, who says that in her country, people with psychosocial disability actually do own their homes sometimes, but they are still deprived the right to live in these homes, in their own houses that they own for a variety of reasons. Have you encountered this in your work also? And a second question comes from, so I'm gonna give them now. I'm gonna give a couple of questions at the same time for you to answer. The second question comes from Alva, who is wondering what innovative practices, except from Housing First, have you learned about through your work? So I presume this means human rights compliant innovative practices. And I was also wondering, because you are mentioning in your report a problem that we have also encountered in some of the countries in their transition from institutions to community-based services, that what happens in sometimes is that people with psychosocial disabilities still, even though there is a transition going on, people end up in kind of ghettos because of the fear in the neighborhood. And I was wondering, how can this stigma in society to allow for people with psychosocial disabilities to really be able to choose their place of living, how can that be tackled? So I'm passing on the mic.
I'm sorry, but the last question, I didn't, the end of the question, could you just repeat the last question, your question, because it was my, something is,
yes, of course.
Hold on one second.
That...
Sorry, hold on one second, there's something. Okay, try again.
Yes. So can you hear me now?
Yes, yes.
Yeah. So what I said is that what we have sometimes seen in countries that are trying to do the transition from more institutionalized services to community-based services, that what happens, and what you mentioned in your report, is also the stigma from many neighbors. And what happens is that these people still end up in kind of ghettos because of this fear and stigma from neighbors. And I was wondering, I mean, how can that be tackled?
Yes.
To ensure that there is true inclusion.
Right. Okay. Oops. Sorry. So I'll take each question in turn. I actually have not directly heard of situation where there is in fact home ownership, but the person with a disability is deprived of living there. I mean, in a way, it doesn't surprise me, and I think that that's how institutionalization and stigma and stereotypes work. I don't know in the Croatia example why it is that they're not able to live there, whether it's families who feel that the person shouldn't live on their own, whether there's a lack of services and therefore the person themselves feels that somehow they should not live there on their own. So I'm not sure. I can only say that it doesn't surprise me, but that it's sort of it's a situation that's interesting to hear about, because it could so easily translate into a positive policy move if the government of Croatia or local governments where this exists could put into place the appropriate services and supports so that they could in fact live in their homes. I mean, in so many cases of deinstitutionalization, there is nowhere for people to go. And so in this case, it's kind of actually, I hesitate to say a good situation, because especially because I don't fully understand it. And it may link with the last question around stigma that leads to, you know, I don't know if it's stigma that's leading to the people not being able to live in their own homes. In terms of innovative practices, you know, my report covers mostly sort of policy, good, I wouldn't even say, you know, we say like decent practices or something, and it covers a number of different ones, mostly from the policy legislative perspective. So some of them I can say to you, you know, in Namibia, for example, they had set up a council to monitor the implementation of a national policy on disability, including ensuring adequate allowances and pensions for persons with disabilities, and developing and providing accessible housing through public schemes. In Finland, they have a very holistic and fulsome policy for advancing the right to housing for persons with disabilities. They have constitutional protection of the right to housing, the provision of supportive housing and community-based support with a commitment to self-determination in the use of forms of support and services, funding for building and renovating housing to make it accessible and suitable, national action plans on homelessness, and a range of supervisory mechanisms, including an advisory board for the rights of persons with disabilities to oversee all of these efforts. One of the interesting things that I really liked about Finland's response to me, so I had asked states for and NGOs and human rights institutions for information about what was happening in different places, and Finland said that it considered those currently living in institutions to be homeless and had set itself a deadline of 2020 to close all institutions, emphasizing the right to live in the community with access to the necessary services and forms of support. So that's pretty bold. I've never heard a state say that before. I thought that was quite interesting. On the last question, yeah, I mean, discrimination and stigma stereotyping is very difficult to address. And I can only say that recently in Canada, a national housing strategy was adopted, and they included as part of their strategy a component that would deal with discrimination and stereotypes about people based on their housing status or other status, and the way that that would interact with housing. And I thought that was also a very interesting move. You don't often see that. So they really want to go after public, so everyday people, to try to educate people to understand, for example, in this case it would be that people with psychosocial disabilities, you know, it's not a disease. I mean, I've heard that in many countries, you know, that people are afraid of people with psychosocial disabilities, and afraid literally that they're going to catch a disease. I mean, there's all sorts of horrible sentiments out there. The way that they wanted, as I understood the Government of Canada's approach, what they're thinking is, you know, in some places there have been big sort of drinking and driving campaigns, or no smoking campaigns, or violence against women, domestic violence, domestic abuse campaigns. And my understanding is that that's sort of where the government wanted to move, where truths are exposed, you know, through multimedia, et cetera. And I mean, I think that that could go some distance. I do think we need government leadership and not just NGO leadership on this sort of thing to create a culture in a place, you know, a culture of non-discrimination. There has to be leadership from somewhere, and people do look to governments for leadership, I think.
Oh, thank you so much. And yeah, sorry. Thank you so much, Leilani, for being with us. And I mean, please stay, because they can certainly be questions along the way. But I was thinking, I think you have really now kind of set the scene. We have been able to see from your, and hear from your report clearly also about the fact that there is still so much forced institutionalization, so many non-human rights compliance kind of housing options for persons with psychosocial disabilities. So what we wanted to do now is to pass the floor to Samara Jones from FEANTSA. She's the program coordinator of the Housing First Europe Hub, and she will introduce a practice which is human rights compliant, which is the Housing First model, and how it can be applied for persons with psychosocial disabilities. So, Samara, I will pass on to you now. And please, all the participants, you can continue to ask questions along the way, and use the chat function to send us questions, which we will be able to pick up on afterwards, after Samara's presentation and the presentation that will follow.
Hi. Hello, everyone. My name is Samara Jones, and yes, I work with FEANTSA, and I work with coordinating the Housing First Europe Hub. And I'd like to say thank you to Leilani for setting up an excellent segue into this presentation. In particular, just to highlight a few of the things that she mentioned that this presentation, and in particular talking about Housing First, will definitely touch on, is the issue of choice. The issue of human dignity, as well the piece that you mentioned in the questions, Leilani, in your responses, is that there needs to be a shift, not just in terms of how states think, but also how services think, how housing providers think, how the systems in general need to make a shift in how they think about the people who are using the homeless services, and to put them at the center of those services. And so we'll talk about that in this little presentation on Housing First. So I'll get my slides up. The presentation is a bit long, so I won't do all the slides, so don't worry. But they will all be available to you, and I've made sure that as you go through the presentation, you should be able to click on the links. So if you want to get to the extra resources that we've included, feel free, but don't worry, I won't spend too much time on it. Just to say a bit like Leilani mentioned earlier, is that there is limited research and data on the link between mental health, people with mental health issues or disabilities or psychosocial disabilities and homelessness. Where there is data, and as well as anecdotal evidence, there is a disproportionate percentage of people who do experience mental health illness or who are have disabilities in the homeless population. And for example, sometimes it can lead to an increased risk of becoming homeless, and the whole issue around stigma and discrimination is a definite factor which can lead to homelessness of persons with disabilities. So, what is Housing First? Housing First is a human rights-based solution. And we have lots of definitions of what Housing First is, but I think the best way to describe it is that it's common sense. You have housing, and that is the very, very first step that is taken in terms of helping a person move from rough sleeping from hostel accommodation or from night shelters straight into accommodation, and then the services are wrapped around that person. So rather than having a step-by-step approach or an approach where you need to decide to be completely sober, or you need to resolve any sort of mental health issues, those things are dealt with in a wraparound sort of service. So, and And the key components of Housing First match up very closely with these definitions that you can, with the components listed in Leilani's report, as well as the UN definition on the right to housing. So as Leilani mentioned in her presentation earlier, this whole idea around the security of tenure, it's crucial in Housing First. And so all of these points are definitely addressed in Housing First. So Housing First, again, this idea that the housing is permanent. So somebody moves into housing, doesn't mean that that apartment is their permanent forever home, but the idea is that somebody remains in housing and that part is not taken away if something needs to happen. So in some of the pilot projects we've seen, there are cases where people have to go into hospital for a little while, but that doesn't mean they lose their housing. Or in some cases, people have to, go and live with family and friends for a little while, but come back. But the housing is always there, and the support always goes with it. So it's not that you cannot fail this program. You are supported along this program from one apartment to another, if that's the case. And who is Housing First for? And there was a lot of discussion about this when the European sort of definition of Housing First came out. So if you go into our materials, you'll see quite a lot of detail about who is Housing First for. And it was really designed, the concept was really designed for those people, the most vulnerable homeless people, who, for the most part, most solutions have been designed for other populations. So they are the people who were sort of systematically left behind, the people often with dual diagnosis, with severe mental health illness or mental health problems, who have drug and alcohol abuse issues, or physical health, or disabilities. So for people who really have high needs and who are living in chronic homelessness. And so that's sort of the core target group for Housing First, but of course that can be a flexible target group as well. So Housing First is a very well-defined approach, and this is important because having these core principles upon which it is based means that a Housing First service can be trusted to deliver the right kind of housing as well as the appropriate services. And because, like I said earlier, this requires a shift in how, for most organizations or for most places, it requires a shift in how things are done. It's really important to have these principles laid out clearly with some guidance on how to follow them, because otherwise you can encounter situations where people are saying, oh, well, we're doing Housing First because we have housing, or we're doing Housing First because we have floating support that comes in to help people. Well, it's not actually Housing First if you don't respect all of these principles that we have here on the screen. So I'll go through a couple of them quite quickly, but they're all available for you to look at in more detail. But first and foremost, housing is a human right, and the Housing First, in housing rights in Housing First, means that the person who is in the housing is the tenant and holds the tenancy in their name. So it's not that they're subcontracted out, there's no, it's not held by an organization in their name. No, they are the holder of the tenancy, and it's they maybe work with an organization to assure affordability, habitability, etc. But they are they have a rental contract like you or I would have. The second point, which is really crucial, is it's choice control for service users. And so this is really important because it is the starting point of where you can develop shared decision making, where you can empower the person who is now in the housing, for whom they've probably been in a systematic disempowerment since they became homeless, if not before. So it's very important that that is something that comes in very early, immediately in the process, to make sure that it's the next steps are a co-production of the person in the housing with the team that's there to support them. Number three, also crucial and also difficult for some organizations, is the separation of housing and treatment. Because in many cases of supported housing, some of which can be very good, the problem is that the housing and the treatment are intrinsically linked, which means that if you do not meet certain behavioral codes, or you have a drink in your apartment, or you smoke in your apartment, or you have maybe a noisy outburst with your neighbors, that the housing, there can be a threat that your housing will be taken away. And so that is absolutely, again, absolutely crucial, that the tenancy lays with the resident, and of course you have to abide by normal, landlord-tenancy type agreements, but the treatment is not part of that equation. And then I'll focus on this last one and then move on, but the whole underlying approach of Housing First is that it has a recovery orientation. So it means that the focus is on the overall well-being of the individual, and that it's starting from that process, starting from meeting their key human rights, starting with housing as an enabling right so that they can access other rights. They can begin a recovery process at their own pace. So these 4 other core principles, I won't go through in as much detail, but they support these the first 4 principles. So in order to help everyone deliver Housing First, we developed with a number of partners a Housing First Europe guide, which takes you step by step through some of the things I've just said, but also how to deliver it, how to deliver the housing, evaluating the process, as well as building Housing First into wider homelessness and housing strategies. And the guide's available for free online on our website in the languages you see on your screen, and happily in 2 new languages coming next year, in Swedish and in German. I wanted to touch really briefly on something that was also mentioned in the questions, as well as in Leilani's presentation and in her report, which is where I got this quote, that deinstitutionalization is crucial, and we like to try and position Housing First as a very positive way to do deinstitutionalization well. That you can have deinstitutionalization without the supports in place, and that can lead to maybe even more problems. But why not look at this as an opportunity to put something robust and human rights compliant in place as people leave institutions, whether it's through the closing down of institutions, or whether it's leaving institutions such as the youth welfare system, the youth care system, or the prison system, etc. And so if you look at the Housing First model, it sets the housing as the first step, and that it makes sure that those community supports are there for the person when they're in their housing. And we touched a bit on Finland in Leilani's presentation, so this is a nice echo as well, that we wanted to put a little spotlight on Finland because they are held out as the best example of Housing First because they are. They started with a goal to eradicate street homelessness and rough sleeping in Finland within, I think they set themselves a goal of 15 years, and they achieved it. They achieved it by setting out really specific plans with targets, and they centered their planning on the right to housing. They put that at the core, and they developed the concept of Housing First in parallel with its development elsewhere, in particular in the US. And as Leilani pointed out, they have this commitment to looking at people who are in institutions as homeless and to eradicating that kind of homelessness as well. And so it's very, very heartening to see that it is possible. And sometimes people say, oh, well, Finland, it's a sort of utopia, Scandinavian country, but in fact, they had very high levels of chronic homelessness and rough sleeping in the 80s and 90s. And it's only, we can only think of them in that way, and you can only walk down the streets of Helsinki without seeing rough sleepers now because they put such a commitment towards it. They recently published a book in English that will take you step by step through how they did it, and it has some really interesting lessons that are applicable elsewhere too. And so I'll just say really two more minutes on this next part, is that we set up this Housing First Europe hub to promote and support the scaling up of Housing First, because we see it as a key tool that can be used to end and prevent homelessness. And that as popular as Housing First might be in terms of pilot projects across Europe, we cannot reduce homelessness, end it, or prevent it with pilot projects alone. Things need to be scaled up, and this is a key practice that can be put in place that can really make an impact on that front. Oh, sorry, my slide is a bit dramatically different there. That's okay. I will skip to the next slide. No problem. Do I have to put it in presentation? Sometimes when you switch computers, the slides decide to take on a life of their own. Where do I decide to put it? There we go. So just to say, we have a website where we have lots of resources about Housing First, how to do it, research on how you can scale up in a major city, training, etc. And one quick note on what we are as a hub is what we've done is we invited a range of partners to come together, not just homeless services, but homeless services, advocacy groups, government ministries and agencies, housing providers, as well as foundations, to say, let's put all of our collective energy and wisdom together to try and push this agenda of scaling up. And so it's very useful to work in this kind of dynamic collaboration, because we've got a lot of really interesting examples as well as expertise from the US and Canada, which have been very important in our work. So our activities, in 2 words, we work on training, practice, and research, and all of the materials that we develop will be available to everybody. So they'll be on the website, they're available through contacting me, and we're very happy to work with all sectors, because in order to make Housing First a reality, all of those sectors need to start to work together rather than just in their siloed fashion. So I'll finish there. Thank you.
So thank you very much to Samara. I would like now, before we pass on to the questions, because we have had questions coming in, but I think it's useful now we have heard about a very good model, human rights compliant model of housing, how housing can work also for persons with psychosocial disabilities, and what kind of support you can need. But I would also now think that it's useful for participants to hear about experience from the ground, because well, we did hear a little bit about Finland as a model of best practice. But I'm going to pass on the floor now to Per Fuglsbjerg, who is an outreach social worker at Projekt Udenfør, which is an organization based in Denmark. And I think you're going to give us a little bit of more of your experience from the ground. And once we have that presentation and your experience, I think we will be able to discuss a little bit more with the participants. So I'm really pleased to welcome you, Per, and thanks for joining us from Denmark.
Thank you very much. And can you hear what I'm saying? You can hear me? Perfect. My name is Per Fuglsbjerg, and I'm from the Projekt Outside, or Projekt Udenfør, an NGO based in Copenhagen. Oh, suddenly, yeah. Our main aim is to alleviate living conditions for the most vulnerable homeless people in the streets of Copenhagen. And in the outreach work, our target group is the most deprived and excluded people living in the streets. And we normally say that it's our obligation to help the people that nobody can or will help. A lot of the people we meet in the streets, they have severe mental health issues like psychosis or schizophrenia. They are sleeping rough, and the majority of the people are living isolated lives in the streets. Most of them, they do not use the social services, so in order to reach out to them, we have to find them in the streets. what a lot of these people have in common is that they have lost confidence in the system and in mankind in general. As I said before earlier, we do outreach work, and what we do in the outreach work is we meet them where they are, and that's in my situation in the streets of Copenhagen, and we try to meet them as they are, meaning we have no requirements for their behavior. They don't need to have a diagnosis or to get into alcohol treatment or drug treatment in order to get help from us, but they can get help from us as they are. The most important thing in the outreach work in Udenfør is to, and I guess into helping people into housing, is building a meaningful and trustful relationship. A lot of the people we meet, they have a history of broken relationships with family and friends, so it's really important that they can depend on us. They need to have confidence in us and need to have confidence in our intentions. Also, the support and the help we give is given in respect to what people want and what people need. We believe that people are expert in their own lives, and we think that participation is a really important factor if we should help people. Also, the way we work, we often start with practical help. We start small. That can be with maybe a help with a sleeping bag or a new pair of shoes. And over time, we build a relationship to the persons we work with until people in the end will allow us to help them with a more long-term solution. And overall, I try to, and the experiences we've seen here in Projekt Udenfør, I've tried to divide it into two different categories when it comes to helping homeless people with severe mental illnesses into housing. I've divided into people that are a danger to themselves or others, and people that are not a danger to themselves or others. And the first group, where people are so mentally ill and in such a bad shape that they are a danger to themselves and others, people often need to go to the hospital for some time to get stabilized, and then we can work after that. But overall, the help and the support we provide for these two categories has a lot of similarities and is more or less the same. The thing is, we support people from the streets and until they get into accommodation. And even when they come into accommodation, we keep visiting them when they're in their housing, and we don't stop visiting or stop the contact before somebody else can take over or they don't need us anymore. So normally we say that we won't punish people for getting better. So, in regards to the people that are not a danger to themselves and others, we try to help them in their situation, the exact situation they're in, and try to alleviate the living conditions they're living under. Our experiences tells us that if people are living a deprived and chaotic life on the streets, they will only think in short-term solutions. They won't make plans for the future. Their main focus will be basic survival. They will think about where can I get the next meal or where can I sleep tonight. Plus the fact that a lack of sleep and food and contact to other people can exacerbate their situation and health condition. So for us, it's really important to try to stabilize people by covering their basic needs and giving them access to, for instance, food, clothing, treatment, maybe a shelter. And if we cannot provide a shelter, then maybe a good sleeping bag. But the most important thing is trying to make their situation as stable as possible. We say that our goal is to take people from the street and put them to the bench, and then later on, maybe from the bench into an accommodation. When people are ready for something else, we can start the bridge building or the case management in cooperation with the homeless person. And that could be bridge building to the welfare system, the municipality, hospitals, psychiatry, or other social services. And in some cases, we think that the person we were working with can benefit from getting in contact with the psychiatry, and then we can establish contact with the psychiatric street team we have here in Copenhagen, and they can meet the person in the streets, and that can have different outcomes, but sometimes it leads to a voluntary admission, or to sometimes people get medication on the streets. The other category are the people that are a danger to themselves and others, and this group is people that are living such a deprived and unworthy life in the streets that we believe here in Udenfør that we have an obligation to act. We have a saying here that says sometimes the worst thing to do is doing nothing. So in these instances, in these cases, we contact a psychiatric team, street team that has access to a psychiatrist that can come out into the streets and make an assessment of the person we're working with. And sometimes that can lead to a compulsory admission. But even though the person is admitted against his own will, we always visit the person during the admission. Then we can start up the good relationship and can start up the bridge building to other relevant services. It's also our experience if the hospitals know that there's somebody working on a long-term solution, then they are more willing to sometimes give a longer admission if it can make sense for the person we're working with, so that we can make sure that everything is ready for the person at discharge. Then finally, when people are ready or so stable or stabilized that they are ready to move into housing or accommodation, that's where we can start the process of helping people into housing. And that we do that again by bridge building, and that can be to the municipality that has access to housing and accommodation, or it could be to other accommodation services. And I think an important point here is that when people move into housing, they really need a lot of support. It's a very vulnerable period for people, and you cannot just take people who have been living for a very long time in the streets and put them in an apartment and expect them to thrive. Some people have to learn how to live in an apartment. It's a totally new thing for them. They are used to the streets and used to the surroundings, so the transition is a big thing for them going into an apartment. For instance, they are used to all the noises and being the noises that are in the streets, and there's noise around them, and are used to a lot of people around them in the streets. So, for instance, we had a guy who thought it was too quiet in his room. He couldn't sleep in the nighttime because it was too quiet. And one of the solutions we came up with there was buying him a radio, so he could listen to the radio while he was going to sleep. And that actually helped him to sleep in his apartment, and it made it easier for him to stay there. Another example is a guy we had that told us he slept very badly in his bed. He couldn't sleep in his bed. And we couldn't understand it. He had a nice bed and everything, but at the end we found out that he slept there with all his clothes on, all his shoes and jacket and everything just on top of the bed. And we actually had to learn him how to go properly to bed, how to lie down and put on the blanket and everything. So, and then another thing that we also seen through our experiences is that it's not unusual that people sleep in the streets in the beginning. They maybe take a couple of nights in the streets, but that's also, from our experiences, that's okay, because that's a part of the transition. And the streets, they know what the streets is, and they don't know what's in the apartment. You could almost compare it to if we had to go out and sleep in the streets, the transition would be just as hard. So, but the most important thing is that in this period and this transition from street to housing or accommodation, the support is very, very, very important. Yeah, I think that's it for me. Can you hear me?
Yes. Thank you so much, Per.
You're welcome.
for sharing your experience from the ground. We wanted to, before now opening up the floor for discussion and questions to the two speakers we just listened to, we wanted to allow for Julien Dijol, who is the Deputy Secretary General of Housing Europe, to react to these two presentations and also the introduction made by Leilani. So Julien, having heard the discussions and the challenges that have been presented, as well the positive models, even in Finland we have heard that there has even been eradication of homelessness. So what is your reaction? I mean, how do you see your role to support housing in practice for persons with psychosocial disabilities, and what are the challenges that you face? So I will leave the room now to Julien from Housing Europe, who has kindly joined us. You wouldn't believe which big of room of people we have here around us.
Thank you, Maria. Thank you, everyone. Good afternoon or good morning. Yeah, I mean, it was very interesting to listen to the presentation, because we start in a way with Leilani from a discussion about rights and the importance of having the right legal framework, and we move towards the question of the practice of housing for people with disability. And I think, of course, as far as we are concerned, indeed we represent social housing providers. We are really interested in looking at the practice of housing with people with disability. And I want to pick up one point that Leilani made in her presentation. She shared an impression that among the social housing providers, there's not always a great deal of understanding of the requirements and the needs in terms of people with disabilities. I think it's difficult to have a clear view, but from our experience with our members, I would say there's a growing understanding and a growing shared understanding about the needs for people with disabilities, and it is reflecting in various practice. And Housing First, I think Samara clearly showed that. Housing First is a clear example where both social housing sector and the homelessness sector and also social services can work together. And in many cases, social housing providers do participate to Housing First. Actually, they are an essential part. They are an essential part of Housing First approaches. And indeed, if we take the example of Finland, when you talk to people involved in Housing First in Finland, they say, I mean, one of the key was indeed the availability of social housing. So it's not all necessarily a question of availability of housing and then basically social housing provider let the other doing the job. No, it's more than that. I mean, when I mentioned growing understanding, I just also refer to the fact that they are shared practices more and more. And indeed, we've worked with FEANTSA and others, and indeed Mental Health Europe, a couple of years ago about the training of the different, the staff of the different sectors to make sure that there's what we call key learning outcomes that can be shared by the different sectors, so that people can understand and speak the same language and try to improve their practice. So training is a key aspect, and it's improving. I mean, I think definitely. The other two or three aspects which I think highlights or illustrates the change, maybe paradigm change, or at least this growing understanding, which I mentioned. First, it's about the finance. I mean, more and more we are looking at how we can finance not only the hardware, the buildings, but also the software. I mean, the social services and all the floating services that go around. And when I say how to finance hardware and buildings, it's not only about highly more high-tech development, but it's also about the small repairs which are needed, the small interventions are needed for to make sure that we meet the needs of people with disabilities, including people with mental health issues. So finance is a key point, and there are more and more the recognition of the need to have a hybrid finance to cover the different aspects of the problem. And another point is about the allocation system. how you're going to allocate social housing, to whom you're going to allocate social housing, is obviously a key issue. Not only because of the growing waiting lists for social housing, but I mean the challenge is obviously to make sure that people will be put in a situation where they are not going to end up in ghettos, suffering from stigma. And indeed, the question of where are you going to put the people facing disabilities is key, and we have a lot of good practice where those people have been, in a way, put together with young people, students. I mean, supporting the intergenerational solidarity. We have plenty of examples in that sense, and so it shows that the practice of allocating social housing is also more and more recognizing the need to have something which fits to the need of the people. So training, finance, allocation system, and obviously at the end of the day, which is what we are talking about, is how you create community. I mean, disability-friendly communities, and I was struck recently by an example of a housing association in Northern Ireland, Radius Housing Association, which has developed. They have developed a strategy to face dementia among their tenants. So mental health issues. They started from the reality, the recognition that in UK made a projection. The number of people in the UK with dementia will double in the next 40 years. And so when you face this reality, I mean, obviously it's very linked to the aging of the population. Then the housing associations have to react, have to prepare themselves, have a strategy. And Radius Housing, so in Northern Ireland, have set up a really proper strategy where they wanted to ensure that their staff understand about the dementia, how to spot the early signs, how to engage generally with persons with dementia. Secondly, they try to design and build their homes specifically for the needs of those people with dementia. And thirdly, they want to create what they call it dementia-friendly communities. So it's not because you're going to design a building which is, I mean, specific and for people with dementia that you're going to put them in an area completely isolated from the rest of the society. So they really have this approach, and I think it's quite illustrating of the. It illustrates, yeah, I think the growing momentum within the social housing sector about the recognition of the need to meet this specific demand, but actually which is a demand which will be growing. I mean, another interesting aspect is if you look at Germany, the German social housing sector is very keen on facing the aging challenge, and they say aging is our number one priority for the future. But aging means a lot of things, including mental health problems, including health issues. So I think we are in a situation where we are living, I think, the paradigm shift. And so I'm a bit more optimistic, probably, than Leilani about the role of social housing. But obviously, we need to do more and more cooperation, like the one we were mentioning before with Housing First. So thank you very much to the speakers. I think it was really great. I mean, I learned a lot, and it's great to continue conversation after that. Thank you very much.
And thanks to you, Julien. We will move on to questions now to the speakers. We had a couple of questions coming in. We have been discussing a little bit about the need for a holistic approach and looking at the different types of services that a person may need together, but not kind of having them depending on the other. I'm explaining myself because we got a question coming in relation to the, so now I'm going to read it out from Alva. Yes, so about the condition, well, in the Housing First, Samara explained that the housing should not be depending on kind of your behavior, and there should not be conditionalities around that. Now we know that in when it comes to support services, sometimes persons with psychosocial disabilities can have conditions on them also for example, the kind of treatments they they have to comply to. They have to take the community treatment orders, for example. So I think that the question for Samara is, so what about, I mean, you have taken quite a clear stance on not linking the housing to other support. That it should not be a condition for keeping your housing. But what about autonomy in treatment, for example? Would you have the same kind of stance? I think that was more or less the core of the question. I'm gonna maybe take another question also before, which will be for Per afterwards. So Per, you can give it a thought whilst Samara is responding now. So it was said from Stephanie that in some Housing First programs, occupational therapists are involved. Would that be the case in Copenhagen? So, but first I let Samara respond, and maybe react if you want to react to what you heard also from Julien.
Hi. Okay. Yeah. So, this is it. For Housing First, the approach is very much about putting the person at the center. So at the center of the choice around the services that the person engages in, as well as the steps that they take in terms of recovery. The sort of second set of principles I didn't go into so much detail on include the idea of having person-centered plans in terms of what are the steps that the person wants to engage in terms of recovery, in terms of harm reduction, or not at all. And so again, the services are not, the condition always is that you have to engage at least on a weekly basis with either the social worker or the Housing First worker, whoever is sort of case managing the support that goes along with the housing. So there is that minimum level of engagement, but then whatever else comes in is based on what that individual is ready for. And wants to do. So I think that the whole concept is to move as far away from coercion into treatment as possible. So it's about setting up the support network. So if somebody does want to engage in treatment, that they're supported in doing that.
Thank you, Samara. I will leave now the floor to Per to maybe react and explain about the question that came from Stephanie about the occupational therapists, whether they are involved in the models in Copenhagen in your outreach work as well, and also if you want to react as well to the previous question on, because you were also mentioning that in your outreach services you are very clear that you do not put conditions on the people in kind of treatments and so on. I will leave the floor to you now, Per, if you want to react.
Is it possible to repeat the first question again? I didn't hear it.
Do you hear me, Per?
Yeah, can you hear me?
Yes.
Is it possible for you to repeat the first question?
So the first question came from Stephanie. She was wondering if occupational therapists are involved in your work in Copenhagen. And my second question was if you want to also react to what Samara was responding to about the importance of not putting conditions on treatment, for example, for the persons that you reach out to. Because we know in other areas like support services for persons with psychosocial disabilities, we see more and more community treatment orders, for example. It's the same question of coercion, one could say. So if you want to react to that, feel free as well.
Regarding the occupational therapist, we don't have one in Projekt Udenfør. But if we should need such a person, it would be through the bridge building. That we had to find it somewhere else in the city. And I need your second question one more time. I'm sorry.
No, it was more the same question that Samara was responding to.
Yeah.
Would you? I mean, you were very clear that you wouldn't kind of put as a condition for your outreach work that persons would need to comply with treatments, for example, or that you would put any other conditions. You said they can come as they are.
Yeah, exactly.
And so the question was a little bit: would you take that kind of stance also in relation to treatment? For persons in general, because we know that there's a big issue of coercion in psychiatric care, for example. I mean, you feel free to respond or not, because it's a quite big question, I think.
Yeah, it is quite big. I will give it my best. We always try to, when it comes to treatment, we try to speak to people about it and try to get people to voluntarily get into treatment if that's what they desire. People don't necessarily need to be in treatment. It's more a case if people are so sick that they cannot take care of themselves, or something really bad can happen. We feel obligated to act towards treatment, or to get in contact with people that can assess this person and see if this person needs treatment. Because I'm not a psychiatrist, but through the bridge building, I can talk to people that can assess and evaluate and find out if this person needs treatment. But in general, I would never force people to go into treatment, if that makes sense.
Thank you. It does make sense. Thank you very much for responding. I know that some questions sometimes quite difficult also, and it's huge questions and challenges that we are discussing. But it was really encouraging to hear that there are so many important good practices out there as well, and that we seem to agree that there is a need to move towards human rights compliance, housing services, and I think it was a privilege to discuss that with so interesting persons today from so different sectors, because we need to work together if we are to reach our goal, which is a common goal, and I think this is a good place to start to discuss it today. I want to apologize again to all the participants that we had such technical problems in the beginning. I was very happy that we actually could carry out the webinar, and I think it was really interesting to do so. So I want to thank you for having stayed with us. And thanks to the speakers. Leilani had to leave us, but we were really privileged to have her with us. Thanks to Samara, thanks to Per, thanks to you, Julien. Thanks to every one of you who were joining us for this webinar. We will publish it on our website, so it has been recorded, and please feel free to share it afterwards. I just wish to close the webinar by wishing you all very happy end of the year festivities, and thank you so much again. Bye-bye.